First of all, Kolbasa, you do lots of stuff around freedom from torture. Can you just take a couple of minutes just to kind of talk about that and the power of the voice and how that's working for you, where you are? That's cool. You can, there, here. I'm good.
Thank you very much. Thank you, Stan, and thank you everybody for inviting us here. Just want to, as I got only a couple of minutes, I don't know what I say in a couple of minutes, but 1 minute I just want to tell you a little bit who I am, and then also what what line of work I'm doing, and from that you can learn a little bit. So as I said, my name is Kolbasa also, and as a child, I was, sexually abused by peacekeepers, and then, as an adult, I was tortured, and then after that, I fled, and I came to seek, protection from the UK. And while I'm here seeking protection, I was put in a detention, immigration detentions, and then after that, for a short period of time, I was homeless in a freezing, street of London for a few days. And then, after that, I was referred to Freedom from Torture. It's a rehabilitation organization. I don't know if you know Freedom from Torture, but from there, I went through a therapy for about 3 years. And then, after the therapy, I decided kind of to, channel my struggle to create, positive changes. Because I believe that as somebody with a lived experience, I am expert. Just expert, no expert by experience, but I'm just expert like anybody else. So I, brought friends together, saying all also torture survivors and also in exile in the UK. Let's turn our negative experience to something much bigger than our individual life. Let's create a space for other people like us so that we can speak. We can challenge policies which is not helping, people that the police is supposed to help. And also we can be part of the solution. And part of the solution means, affecting the services that's supposed to help us, and also affecting the government and also the MPs and everybody that's here looking for a solution for us. Because if they need a solution, so we need to be part of the solution. But that said, it's not easy done, but there's always challenges. And so we look at how to overcome those challenges by creating a space that people feel safe, creating a space which, I don't want to use the word empowered. When you use empowered, it means that one person has the power, then the power will be given to another one. But it's not empowering, but to strengthen people's ability, people's skill, so that they can be able to use whatever they have kind of to make positive changes. So that's in 2 minutes what I have to say. Thank you very much.
This is Alex from Groundswell. You can do it. You get 2 minutes too. Be kind.
Okay. Hello, I'm Alex. I work for Groundswell. We're an independent advocacy service. Just briefly, from the age of 20 until I was 59, 5 years ago, I was formerly excluded. I had a formerly excluded lifestyle. In that period, I spent about a year maybe living in a hostel, a year in hospital with tuberculosis actually, and about 2 years in prison, 2.5 years in prison. When my health kind of gave out around about 4 or 5 years ago, Hep C and stuff like that, and just general lifestyle, addiction and stuff like that, just all collided and it collapsed. I came out the other side of it, and with the, I think I was, the time I spent in hospital and stuff like that gave me time to reflect, also gave me time to clean up my act and stuff like that. But what I came out thinking, I had these skills which are to do with, I learned these skills, I picked up these skills which were to do with achieving what I wanted through my communication. And with a lot of excluded people, like homeless people, and people who are sort of marginalised and have no agency, a lot of issues arise from being able to communicate once you get in to see a consultant or a doctor. From that, I was came across Groundswell, And without, the term wasn't in use at the time, but and I don't describe myself as it, but it's quite a nice term, I found out I was qualified by experience. And that was it's quite a moment for me. Since then, I've been spending about maybe 3 to 4 days a week, every week, doing in-reach work, which is where I go into hostels and into day centres and stuff like that. Basically taking care, trying to engage with like street homeless or people who are effectively homeless, to actually get them engaged with the health services. Do a lot with Hep C. We've got the Find and Treat, the TB service, but in general, just trying to get people engaged. Is that about it?
Yeah, you can do the pen over there. You'll get lots of time when the Q&A.
Okay, all right.
So, all right.
Yeah,
Lovely,
thank you very much a lot.
Thanks. We've got. As I say, once you start getting oversubscribed, and I think true reflection is actually of the audience you've got, is that people are wanting and willing to share and wanting the willing, and that's testimony to the passion that you demonstrated, kind of sort of like a cosy blanket. So we're going to start to introduce the others to either come up or they can talk where they are. There's going to get a similar sort of time, and then we're going to throw it open to questions. So whoever wants to go first, well, I'll let you choose. Draw straws.
You go from here?
Go for it.
Oh, I'm standing here. Morning. So I'm an expert by living, I suppose. So I don't want to go too deep into my life, but so I went through foster care, children's homes, hostels, bed and breakfasts, involved in criminality, ended up becoming homeless at one point in my life. So I then met Stan with Pathways. I was introduced by a friend, and I've been working with him for the past year and a half. Been interesting for me. I mean, it's my first time speaking to such people as yourselves. But yeah, I think a lot of the stuff Stan and Pathways have been doing is very eye-opening. It's if I could give you an analogy, I think we all heard of these stories where children are left inside the wild and they end up growing up and becoming feral. And that's because of their environment. So imagine we've got that on a smaller scale. We've got people who live on the streets, who sleep rough and live on the streets. That affects them in the same sort of way. And it's quite difficult to kind of get that acknowledged and get the help and the seeking, the therapy that you need to get through that. And I think the first thing that Pathways has done for me is acknowledge that there is an issue with that and that has to be addressed. So, moreover, when you see someone who's street homeless, you have to understand that they've got a multitude of problems, not just the problem that they're presented with at the A&E or at a hospital. So that's about it. Thank you.
Hi, my name is Adam, and I'm here to tell you a little bit about myself and my journey. I first came into contact with the police when I was 9 years old. 21 years and many stays at Her Majesty's pleasure later, I find myself here in front of you all. A couple of years ago, I met my partner who introduced me to the Revolving Doors agency. Since then, I've been fortunate enough to be involved in lots of projects, from group research to forums to working alongside the Inspector of Probation. For me, this journey has been a long one, and it isn't over. But if you had told me 5 years ago, when I was sat alone in my cell, that I would be using all these years of experience, all these years of mistakes as work experience, to be able to help improve the system and help other people, I wouldn't have believed you. Many offenders, including myself, have been let down by the system, by services, both in and out of the prison. The lack of support that's out there easily leads to reoffending. Look at universal credit, for example. People are out there starving. Of course you're going to reoffend just to make enough money to get food, or even end up stealing the food. More services need to involve lived experience. Some are afraid to hear what we have to say, because a lot of it is bad. They don't want you to hear how their services are failing people. We are not here to take your jobs. We are here because we want to work with you to help change the system. Revolving Doors Agency gives people like myself and others who have been stuck in the revolving door system, that is the criminal justice system. I've gained more confidence, more opportunities, and it's shown me that some people do care about what I have to say, that I'm not just some criminal, but a human being who has made a few mistakes and wants to change.
Hello, everyone. My name is Mo. I come from a country which is currently undergoing what I can call genocide. That is Cameroon, if you will know. And when I got into this country, my parents had to take care of me. But along the line, they were attacked, and every property of my family was destroyed. I was left helpless in the UK. So I had to go in for asylum. When I went in for asylum, they sent me to Bradford. While in Bradford, I went through a lot of trauma till I came in contact with Bevan Healthcare. At this point in time, I had suicidal thought. When I came in contact with Bevan Healthcare, they didn't take in consideration the policy put in place, but they came to me, they talked to me, and the communication helped a lot, saved me and kept me standing today. What I want to say today is, in order to make the health more inclusive, strategic communication skills must be put in place. We cannot afford to let other people go their separate way just because of policies. Policies have to be reviewed every moment, every day, in order to assist people who are helpless. Inequality in health is something very important, and we must take that into consideration. I see that evolving so greatly with Bevan Healthcare, Bradford unit, and I want to appreciate that effort they are putting in place. Thank you.
Yeah, I'll stay here. All right.
Yeah, it should be working.
Is that working now? Yep. Yep. Sorry, I'm down here because I'm for the people. It's got me in a lot of trouble in the past. Right, my name's Linda. I'm from Leicester, and my journey starts just as I thought was just normal. I grew up. I had 2.4 children. I had a couple of dogs. I had a house. I had a career, and my career was my life after my children. I ended up having issues at work. I suppose I ought to say, I'm a nurse. I was a manager, a budget holder. I had some issues at work, which meant that I went on long-term sick. I think it was my voice then. I sort of spoke out, probably not in the correct forum. So I was investigated, which led to self-harm, which led to the crisis team, which led to an increase of alcohol, which was quite a normal journey. But my increased alcohol it just went on and on. Because it was going on, my kids then, they booked a van one day, and they were 15 and 17. My husband had already left. My house was looking a bit dodgy, and one day my kids got in the van with their beds and left. Didn't know where they were, didn't know where they were in the country, anything. That was a shit Christmas. I was lucky. Because I started in the NHS, I've been in the NHS for 37 years, I was able to retire at a nice age. So I took my retirement But there was a lot of loss. I lost my house, I'd lost my kids, my career, my self-worth, my respect, self-respect, lots of loss. But I did do something about it. I don't know what made me change, but I started to go to meetings, and then online one day I found this organisation called Dear Albert, and I just rocked up and went, hello. And as far as I knew, this is just what it's like in life. I came across this organisation that they understood me. I could just sit there. I didn't have to say anything, and they could just go, do you want a coffee? I go, yeah. And that's how it is today. And I am now somebody that, my journey went on from there. I had to have a clinical detox, which was the easy part. Yeah, I just went in, got lots of medication, came off alcohol. And then the hard bit starts because your life is just collapsed around you. So I moved house. And my kids, well, one of them, I am now back in contact with one of them. But the main thing is that people understand me. I'm really lucky I have two sisters that have supported me all the way, but I can't phone them up in the middle of the night when I'm dying for a drink and can't cope with life things, because I'd learned over the years, if I'm stressed, if I've got a problem, it's quite normal in this country, you just have a drink. Yeah, have a drink, a cup of tea, a glass of wine, go to bed, be all bit better in the morning. But my alcohol had taken off. So my sisters, although they can support me, they don't understand what I need. And I met Dear Albert, and there were people there that just understood me. Dear Albert social organisation, it's a community hub, so I didn't have to go away. I refused to go to rehab because I'd got children, which I didn't then have. But it's recovery focused. We're all from such different backgrounds there, but we all have common problems that we can share, and we can just sit in a room and just say, I've had a real shit weekend. I've had a good weekend. We can celebrate, we can commiserate, we can help each other. So I started going to groups, being able to talk and listen. I've had one-to-one counselling from them. I've been able to become a facilitator with Smart Act. I'm actually now the link between number 5, which is the wet day hostel. So I'm the link between the homeless and that, and Dear Albert. And the actual end of my journey, I don't know where it is, but I'm now getting on to the bit where I'm going to go back into employment, and I'm going to work for Dear Albert.
And the last cab off the rank is going to be Felix. And I'm sure some of you have met Felix before.
Well, hello everybody. Yeah, I'm Felix. Well, I don't really know what to say after all of that, really, because as usual, I'm left lost for words, which is hard for me, anybody who knows me. But my journey is different because I've never been homeless, but I'm fortunate enough and privileged enough to support people in my community because I'm from the LGBT community. I'm a trans man. I'm lucky enough to work with people and support people who are homeless, who come to me for support to a transition. And it is a privilege because I got involved with Pathway through the NHS England, and I'm so pleased that I did, because it's given me such an insight into the lives of people who really are out there on the edge and really, really need help and support from all the services out there. And I went to a session yesterday, and it was Doncaster service, and they're doing some fantastic work. And that word integrated services that I keep hearing flying around until yesterday, and it actually landed in Doncaster. And I thought that was so fantastic. And I think the work that Pathway do is just incredible, and they need all the support and all the help they can get. And I'm so privileged to have been, for the last 3 years, involved with Pathway and all the team. And I hope I can be involved in the future, because, you know, there's people in Hull who definitely could do with Pathway services. So let's get some funding in there, and let's get Pathway up north, is all I can say. And thank you, everybody who's let me join in today. Well done.
I mean, as you can see, you know, having a decision to make when oversubscribed for an excellent panel, it's a no-brainer. I'm going to ask you to make a quick decision, a bit unprecedented, but, you know, we're running kind of 1:45. We're meant to finish at 11. Could we show of hands, anyone mind kind of delaying your break for 5 minutes? Is that all right? So we'll grab another 5 minutes. Are you happy to delay your break? Put your hand up. Lovely, that's carried. That's enough, Tar. That's what you call real democracy, folks. Well done. What we're going to do is we're going to throw it open to some Q&As, and there's a couple of roving mics there. I'm going to just put a couple of ground rules in straight away. I'm just going to remind you what I said about safe disclosure. Please be respectful. If somebody doesn't want to answer the question, do not repeat the question. Simple as that. I watch lots of 1970s humour. I know a heck of a lot of put-downs. I'll use them. And it's going out live, so behave, really. And secondly, lots of opportunity to talk about your organisations and to do that. So no double glazing sales speeches. We need to just get direct to questions, because we are limited for time, hence the reason why I'm going to shut up. We'll take the first question. One there, and there's one there at the back. You got a mic? Yeah, please.
Thank you so much for sharing your stories, and I sort of wish you actually had a bit more time to do that, because I really appreciate trying to say that difficult stuff in 2 minutes. So I kind of think you should have the right to be able to ask anyone difficult stuff and summarise it in 2 minutes here. I'm a GP in Bristol, and I work with street sex workers. I'm about to embark on an exciting project, a co-production project, so actually the women can be making some of the decisions about how their services are designed. And it's really exciting to hear that does seem to be quite a theme of people saying that we need to be doing this as a co-design. It's a bit of a journey both for the services and for the experts by experience, because the services are not used to letting go of that power, and that's a bit of a journey, and also for experts by experience. Even when I speak to the women about this project, it takes a little while to kind of warm up to it, because they're not used to being asked and not used to being involved, and they're used to being told this is what's available and you jump over the hurdles that we set, and that's how it works.
And your question?
Oh, sorry. Have you got any advice for how we help that transition for experts by experiences? You know, yeah.
Anyone on the panel going to take that?
How to help expert by experience to engage.
What I will say, the key is listen. Always listen.
Yeah, can I start then? Yeah. So at Freedom from Torture, I was recruited kind of to develop a service user engagement here. I think you know what service user engagement, right? So for me, the most important part was a space where, you know, those people, or we call it, you know, service user, can feel that space belongs to them. And because in the past was tried, which was a group mixed with staff and also service users. And the feedback that we received, that when staff were there, service users don't feel at ease kind of to openly speak, because they feel that maybe it's not easy kind of to bite the hand that's feeding you. So then create a space where service users feel that the space belong to them. And also, the train people, help people kind of to build their skills of understanding that in that space, they're providing expertise which is needed for them to help the organization or whoever helping them to help them better so that, their need can match the support. The power balance is a very important issue that we also face as Freedom from Torture, and we're still kind of struggling with that. But is to have a clear leadership, leadership from the top and leadership from the bottom to understand that is a crucial part of what we do as an organization to make sure that what we do is centered to the people that we're supporting. And when that understanding throughout the organization kind of is embedded so that people understand that part of the job is also making sure that people who live the experience can contribute to the services, can design the services, so then people will get the help that they come to seek for. Thank you.
Thank you. We've got another question here. Yes, please.
Morning. My name's Susan. I'm an F2, so I'm in my second year of junior doctoring, and I'm a director of a night shelter. Thank you so much for speaking to us this morning. It has, as I'm sure a lot of people will agree, been really moving and really valuable. Most of my experience so far in working has been in secondary care, so in hospitals. And I was wondering, it's probably quite a basic, simple question, but as do you have any advice as a patient who's maybe been homeless or sort of faced marginalisation before? Any advice on what we as professionals can do to make a hospital visit more pleasant or easier to deal with, or to make interactions with professionals sort of the best they can be?
Somebody else want to take that one?
Yeah, I would love to take that question. Like I said, I'm not doing a promotion of Bevan Health, but when I came, I was in a very traumatized situation. When I got to contact with Bevan Healthcare, what keeps me visiting Bevan Healthcare today is the fact that when I was this vulnerable, they took me to the level of attending one of their board of governors meeting, making it so inclusive, giving me as a service user the opportunity to discuss what I was going through and what I think can help the organization meet the needs of the people they are out there to save. So communication, as I said, should be strategic. We must take our professional skills and bind it with the unbleeded skills, which is the expertise skills from people who has got experience. We must bind it together in order to meet the needs of everyone in the society if we really need an equality in our health services.
Hear me? Yeah. One of the main things that I come across when I'm supporting people engaging with the health service is the communication issue that goes on between the client, the patient, and the doctor. It's quite difficult to say, and it's even more difficult to acknowledge. There is a degree of prejudice that lingers, in our psyche. The thing is, what amazes me is, I pick people up, and these can be rough sleepers. I've got there at 8 o'clock in the morning. I've got to sort out the dog. Then I've got to sort out the dog. I've got to sort out their methadone. Then we've got to get into the appointment. And they're going in and they're feeling that they're not going to be taken seriously. They need a bath, they need a wash, and they need a drink. And so there's Something, I'm much nearer to the people I'm supporting than I am to the doctors. But I go in there, and all of a sudden it seems to change once you have the gravitas of the Groundswell ID badge, and so there's something going on there where, I noticed the change in with the clients who come and going. Well, that was amazing. How that worked out. So there's. What I would say is it would be a difficult thing to do, but it's to ask doctors, all doctors, and I mean all doctors, not just consultants or trainee doctors, stuff like that. I mean, everyone working within the NHS to consider some kind of, training or whatever you want to call it, but the thing is for this lingering prejudice. And just one last thing I want to say. Professor Paul Cosford leads once or twice a year we get to go and meet young doctors, and out of all their training, thanks to Al's story over there as well, Dr. Al's story, we get to engage with these young really nice young crowd of young doctors, and they're there, and what this 1 or 2 days of training is about, engaging with the excluded. So I think NHS England needs to take that a bit more seriously.
Got one at the back, yes. Thank you.
Thank you. May Reid, Mayday Trust. There's a very kind comment from somebody that professionals need not worry. You're not after their jobs. Why not?
We don't want your jobs. We just want to help the system, and
I would want.
From our point of view, from being lived through the system, and we don't want your jobs. We just want to help you.
We've got Nigel, and then we've got 2 more. So there's one over there, and I'm going to take one more after that one. So Nigel,
can I just say one thing to that, and also the other question is the other thing that I think is really important is to frickin' pay people for their expertise, including experts by experience.
Well said.
Pathway. I had a specific question for Joe Ensign. If you could just expand a little bit on the concept of historic trauma. So it's something we don't think about as much as we should in the UK. We've heard from colleagues in Australia that a third of their street homeless population of Aboriginal heritage. I know from Heinrich in Copenhagen that a third of the Danish street homeless population are Greenlanders of Sami heritage. And we heard from Steve Powis earlier today that how people of Afro-Caribbean heritage in the UK are more likely to suffer strokes. And I just wanted to give you the opportunity to explain to us a little bit more about the concept of historic trauma and what we might be able to do about that.
Okay, the historical trauma in a very short period of time. Yes, and so historical trauma, it goes to epigenetics, right, in terms of just like how it is passed on, working with the Maori population in New Zealand in terms of the historical trauma with populations. Working with, obviously, African Americans in the United States in terms of our really awful legacy of slavery, not just in the South, but throughout our country. And so it's really acknowledging the historical roots of trauma over trauma. I mean, what I understand in terms of what, for the UK, part of that, Ireland, I know, I don't want to get into Brexit, but Ireland, Scotland, the clearances. You have a social historian here, David Hitchcock, who talks about welfare colonialism and that whole kind of like getting rid of the excess poor people from the people who are excluded from the very beginning and getting rid of them, and just how that actually gets passed on generationally. And so for us as healthcare providers, or us as experts by experience, to understand where those roots are, the LGBTQ population, realizing just how recently it was illegal to be gay, like that should be legal or not. So it's like is understanding and asking the person if they don't know that part of their history, but to really try to acknowledge that and to find out from that person, like maybe how they are experiencing historical trauma.
Hello there. First of all, sorry guys, I think I should be up there, but I was 10 minutes late this morning, and that's an obstacle course. Basically, it's been mentioned a few times about perception and prejudice. But yes, I'm an expert by experience, but certainly while I was street homeless, I presented at A&E twice. And both times I gave my daughter's address, I would have died rather than anybody think I was homeless. So admit that kind of prejudice comes from both ends. And also, I think Josephine mentioned hiding the fact. I still have extended family members that think I live in shared accommodation and I have a part-time job in media marketing, which is the absolute truth. I lived for 4 years in a hostel and I sold the biggest shoe on the Horseferry Road. So it's the absolute truth, and it's completely unreflective of everyday reality. They think golden girls in an office and, well, let them off. So it comes back to equality at the end of the day. And there seems to be a differential between the sort of them and us. But in reality, in a country where 1/3 of all households have access to savings of less than £100, you all need to look at yourselves and say, okay, if I didn't have an income for 6 months, where am I? And a lot of people in ivory towers all over England are a lot nearer the road than they think. And that's all
I have time for one more, and I'm actually going to put him on the spot because I'm sure you appreciate that. Driving this stuff forward, it actually takes a lot of resources, and we were shy of resources this year, and Stephen Robertson, the Biggest You Foundation, actually dug deep and have helped us with some of the funding for this. So you're going to get the privilege of the last question. What would you like to ask? On the spot, mate.
I'm on the spot now.
Oh, and do you think it's been value for money?
I think it's been amazing.
Well, remember that when you're getting asked for money on the way out the door. Cheers.
I'd just be really interested to know from the panel if you think there are enough experts by experience engaged in the health system, or you still feel this is really kind of pioneering at the moment. And if that's the case, what could be done to promote and widen the reach? Because clearly there's a huge amount of value.
Good question.
Yeah. Personally, I think that the alcohol team should have somebody that's got alcohol experience on it. Like, if you're going to talk to somebody who's actually just said, I might have a problem, do they want to talk to somebody that's read it out of a book, that might be able to wave a little leaflet at them, as opposed to somebody that can actually have that empathy and understand and just congratulate them for saying it? Just listen to people. But NHS have not got that time to listen, but it's the one-to-one listen and talking.
I just want to have a kind of small anecdote that, I want us kind of to have that in mind. When we're talking about, expert by experience, we want to talk about service user or consumer and all those kind of things. It's the anecdote that goes like this. For example, you had a friend over and you cooked a nice orange pudding cake that you read from a recipe book. And then, the friend ate the cake with the tea, but you haven't not tasted. And then 10 minutes later, another friend come over and then ask, guys, what are you eating? And then you, as the person that cooked the cake, you said, it's an orange pudding cake. And the next question, the friend said, how is taste? So now, between you and the person that ate the cake, who's the best person to explain how the cake tastes? Right? So it's also the same methodology. You always have to think, when you want to find out about the service that you're delivering, who's the best who will give you the information that you need to improve the service? So that's my point.
As you can now see, this is now my cue to scoot. Hopefully in the last 45 minutes or so, you have seen exactly why I do my job. To share space with just some amazing human beings like this are, well, it's mind-blowing. Yes, it's got its challenges, like everyone else's, but you know what? The rewards far outweigh it. I'm going to briefly answer your question. If you want to expand, no, there isn't enough. There isn't enough people like this sitting on boards and sitting in panels and answering questions and guiding and leading. So I think take this catalyst and take it forward. And you know what? Just invite people in. Give them some orange cake and ask them what it's like. And listen. I'm going to depart the stage, but let's do another thing that breaks with a bit of protocol. I think that, you know, a simple round of applause is not reflective of the efforts they put in. I want to hear lots of noise as they leave the stage. Thank you.